Hello. Welcome to this week's episode of Dialed In on Diabetes. I'm Dr. Marian Sassetti, a family physician in Oak Park. Over my 30-year career, I've developed a personal and professional interest in mental health challenges and how they impact the health and well-being of our patients. Today, I'll share some simple techniques that can help you address behavioral health issues while improving outcomes for your patients with diabetes. We know that people with a chronic condition like diabetes have an increased risk and incidence of depression and anxiety. Many of my patients feel depressed, sad, guilty, angry, frustrated, and just plain overwhelmed with this diagnosis. Diabetes is part of every waking moment for them. They don't get a break or a day off. They can feel burnt out. What are the signs of this? The patient may stop checking their blood sugar or even lie and report false numbers to family members and you or your staff. You may see weight gain and episodes of binge eating. Frustration and fatigue can set in for them from the daily care regimen. This can lead to depression and anxiety in the patient, as well as family members, such as their spouses, their parents, or their children. How can we focus patients on their overall health and life goals and then fit caring for diabetes into that overall plan? First, let's get real and acknowledge that diabetes is challenging. I tell my patients, yes, life often feels unfair and unjust. I'm so sorry you have this diagnosis, but I am happy you chose me to be on your path with you. I suggest we ask our patients, what's your greatest fear about having type 2 diabetes? And what help do you need to make you less afraid of these things? Then I suggest giving them concrete resources that will help them manage these issues. This could be a referral to a counselor or connecting them to a local or online support group. What's their support system like? Do they have support from family, friends, their job or school? What technology supports, such as glucose monitors or apps or calendar reminders, can help them? Who are the people who provide the meals, manage medications, and set up appointments? Make sure to include those people in the conversation. Patients with behavioral health diagnoses have already faced tough challenges. Explore the same problem-solving approaches that they've used in the past to effectively control diabetes now. If the patient is already seeing a behavioral health specialist, make sure discussing diabetes is part of their plan at every visit. Do you have someone on your team at your practice to spend time integrating their specific diabetes management strategies in their self-care plan? Let me give you some evidence-based strategies that we can incorporate into caring for our patients with mental health challenges as well as diabetes. These tactics are low cost and have excellent outcome data. Energy work, such as Tai Chi, yoga, Qigong, and Reiki, have all been demonstrated to have significant reductions in anxiety and depression. Movement that is therapeutic and peaceful is a great introduction to the concept of exercise that all our patients need. Two supplements that are solidly backed by research are omega-3 fatty acids and zinc. Additionally, suggesting that our patients boost their intake of iron, magnesium, potassium, selenium, B vitamins, vitamin A, and vitamin C have positive impact. Excellent neurobiologic research shows that forgiving someone can decrease anxiety and depression and increase efficiency at work as well as in athletics. Expressing gratitude for 3 things daily also decreases anxiety and depression. Recent research from the United Kingdom has validated that being out in nature decreases anxiety and depression. Just 2 hours a week has an effect. These are all suggestions that patients can easily incorporate into their daily lives. Creating a plan and following up on these interventions is well worth it. Ask your patients and families to visualize their best health outcome. How do they see themselves as healthy and thriving? How will their daily life be better? Then revisit these questions at each visit. How is their daily life better? Remember, your patients with diabetes may need help with the emotional and psychological impact of diabetes first, in order to take on the responsibilities of managing the medical side. Visit iafp.com/DID for resources on this week's topic. Next week, we'll get into obesity and diabetes. I'm Dr. Marian Sassetti for the Illinois Academy of Family Physicians Dialed In on Diabetes campaign.